to retrovert.
Yeah.
But even people with a small pelvic incidence have also retroversion. But it seems that they have less sacroiliac joint pain when they have a totally flat back or things like that. But this is difficult to quantify.
Yeah, it's a really interesting talk. Are there any questions out there?
I'll pose a question. In orthopedics, malaligned joints become painful, and it's important to understand the malalignment, but we still have to understand the mechanism of the pain. So what is the mechanism of the pain in the circumstances of malalignment?
The mechanism, there are many mechanisms, I think, that because it's not only the sacroiliac joint pain, it's also other reason. Muscle fatigue is the reason for pain. So because you have to keep the balance, so the psoas muscle is often involved, and also the posterior stabilizer too. And as I showed you, this pyramidal muscle which participate to the sacroiliac joint stabilizer, they have also a lot of stress. So I think that the reason for pain is really multiple. But I think that if we stabilize, for instance, the sacroiliac joint by fusion, we probably decrease a lot of reason for mechanical pain at this region with the nociceptor that were described before. But of course, the muscle pain will still stay there because the patient will need to compensate. So the main reason before treating joint pain when you have flat back or things like that is first to restore good balance. And after that is the balance is properly restored, I think the sacroiliac joint pain is less. But for patients, for instance, with high pelvic incidence, and if they are old, it is sometimes difficult to restore exactly the shape we want because it's too much surgery and too aggressive, extensive surgery, 1-2 level PS or things like that. It's too much. So for those patients, we need to find a compromise with a corrected spine, but not completely, still using the capacity of pelvic retroversion. And for this reason, we can have sacroiliac joint pain. And by fixing the sacroiliac joint, we treat one of the reasons for pain. So it's always a compromise in the elderly, I think, and knowing this reason for pain for patients with a high pelvic incidence, I think it's another reason to treat the sacroiliac with fusion.
Thank you.
There was another question, Jörg.
Yeah. Hi, everybody. Thanks, Jean-Charles, for again explaining us, how this balance thing works. Actually, my question is, if you go to the SI joint and fuse it, maybe with a long fuse in conjunction, I will talk about that later. How would you see, the effect on the upper end of the fusion, right? Is it better to leave a little bit of that mobility in the pelvis, or does it increase the PJK risk? What do you think about it?
If you fuse the sacroiliac joint?
Yeah.
Oh, it's only a question of balance from the top. That means it's according to the position of C2. So C2 gives you the line that you can draw to have the gravity line. It's very close to gravity line. So if you are able to keep the gravity line in good position, close to the femoral head, it doesn't matter. The problem is to put C2 in good position. And
if
the
not,
PGKs
especially in the
are
elderly,
always due to the fact that people take C7.
Yeah, but the question is, as we both
in the elderly, you have to sometimes to find.
So if we can't keep that position due to kind of elderly patient osteoporotic, can't bear the amount of surgery, is that then something where you rather live with a little bit of SI pain, or is it we don't know?
I think it's better to stabilize their sacroiliac at this age, because they will always have sacroiliac joint pain if they retrovert a lot. So if your correction is not possible, which is often the case because they are too old, the sacroiliac joint fixation is a good option for those patients.
Okay, should we move on, Volker?